reporter and anchor here in Baltimore at WBAL TV 11, and for the rest of the afternoon, I am your host as well. I hope everyone is taking advantage, as we said, of everything Baltimore has to offer this week. It really is a tremendous city, and I want to introduce a true ambassador to this city, Baltimore City Mayor Brandon Scott.
Good afternoon, everyone. Thank you so much, Kai, and thank you for what you do each and every day for us here in Baltimore. Again, I am Mayor Brandon Scott. I want to welcome all of those who are not from Baltimore, and if you've never been here, welcome. For those who haven't been here in many years, welcome back. And those who live here, we know that you know how great our city is. This has been an excellent week of having the CIAA in Baltimore as we showcase Black excellence in a Black city. I want to thank all of our sponsors over this week, all the names that you see on this board behind me, the Step and Repeat, for helping support this great event that is much more than a basketball tournament. It's about Black culture, it's about education, it's about opportunity for Black students. But today we're here to talk about something that we don't talk about enough in the Black community, because we cannot be the best excellent Black selves if we are not in the best mental and physical shape with our health. We have to take care of our bodies. I preach that as mayor of Baltimore. My staff hates it because I have workout equipment in my office. I don't eat meat. I don't drink soda. I'm always pressing on people to be more physically active, but also to deal with your mental health. We have to get away from that stigma. It is okay, as I always say, to not be okay, but it's also okay to talk to someone, especially for my fellow Black brothers. We are not weaker when we share our feelings and we're vulnerable in that state and we're able to grow. It makes you a stronger man, because what makes you weaker is if you hold that inside or take that out against people around you or people that you don't know. So I know you guys are gonna have a great panel, and we're gonna continue to have a great semifinal Friday and a good championship Saturday. Tomorrow we'll have a lot of fun tonight, but I can't wait to see what we learn and hear today from this excellent panel, especially our wonderful Health Commissioner, Dr. Terraza. Thank you so much, Con.
All right, thank you. Wow, I knew that you didn't eat meat, Mr. Mayor, but I didn't realize that you don't drink or alcohol. None of it. All right, good. All right, well, before we go any further with our panel, I do want to again thank our local contributors who have made today's event possible. Carefirst, Johns Hopkins, University of Maryland Medical System, and Art of Balance Wellness Spa. Thanks again to all of you, appreciate it. Next, we will start a conversation that has consumed us for the past 2 years, COVID-19. As the devastating numbers of infections and deaths reflect, it has hugely impacted us all. On December 31st, 2019, when the first coronavirus case was reported in Wuhan, China, we had no idea of the impact it would have on the world. And since March of 2020, we have adhered to guidance and restrictions at the advice of public health experts and government officials intended to reduce the transmission of this novel coronavirus and keep us all safe and healthy. According to the World Health Organization, there have been more than 416 million confirmed cases of COVID-19 globally, including 5.8 million deaths. The good news is that more than 10.2 billion vaccine doses have been administered globally. And for the CDC, reports that the US has seen more than 78 million COVID-19 cases with nearly 927,000 deaths. While more than 80% of all Americans over the age of 5 have received at least one vaccine dose, health equity remains a priority. Right here in Maryland, we are approaching 1 million confirmed cases. These numbers reflect even more lives, families, businesses, and communities affected. COVID-19 has truly taken a toll on how we live and continues to impact our way of living. Black and brown communities continue to be impacted at a higher rate due to healthcare inequities related to socioeconomic circumstances, housing conditions, health access disparities, and distrust of the health institutions and the government. And while the vaccine has been available for nearly a year, there are communities of Black and brown people who remain reluctant to get immunized because of past racist and often dangerous health policies and clinical experiments which targeted vulnerable Black and brown communities. This afternoon, we are joined by a dynamic panel of experts who will discuss the past, the present, and necessary steps for the future in the context of COVID-19, exploring why authenticity matters as we continue to grapple with this ever-evolving disease and its impact on our physical and our mental health. So without further ado, let me introduce our panelists. Unfortunately, we do have to say the original human beatbox, Dougie Fresh, was unable to join us, unfortunately, this afternoon. He had a death in the family, so his travel was delayed. As the Vice President of Entertainment of Hip Hop Public Health, which aims to deliver positive health behavior change through the transformative power of music, we were really looking forward to hearing his perspective, of course. Let's all keep him and his family in our prayers. Also, Dr. Lakita Carter was unable to join us as well. So our first panelist is West Baltimore native and founder of Heart Smiles, Joni Hollifield. In 2015, the unrest following the death of Freddie Gray left many of Baltimore's youth feeling hopeless and powerless. In response, Joni retired from her executive leadership position in corporate America and founded Heart Smiles to restore hope and place youth at the intersection of access and opportunity while building their capacity as strong leaders. Now, in partnership with the Johns Hopkins Bloomberg School of Public Health and Bloomberg Philanthropies, Heart Smiles operates a city-wide program teaching youth the fundamentals of leadership, entrepreneurship, and the importance of giving back. Joni is a trusted voice in all things youth, including engagement, development, and relationship building. Join me in welcoming Joni Hollifield. Hollifield, right? Hollifield. Next, we have Dr. Letitia Jaraza, who is the first African-American woman to lead Baltimore City's health department. Taking the helm as Baltimore's health commissioner in March 2019, Dr. Jaraza has navigated the city through the entire COVID-19 crisis, staying ahead of outbreaks while dispelling myths and getting all Baltimoreans vaccinated. After graduating from HBCU Meharry Medical College, summa cum laude in 2007, Dr. Jaraza became a Johns Hopkins trained pediatrician. She believes that equitable care is a fundamental right for all and tirelessly advocates for programs that support the overall health and well-being of all Baltimore City residents. Dr. Jaraza, we are really grateful for your leadership. Thank you for taking time out of your busy schedule because we know it is extremely busy right now. We are also joined by Angela Celestin. She is the Executive Vice President and Chief Human Resources Officer of Carefirst, Blue Cross Blue Shield, the region's largest not-for-profit healthcare company. Since 2019, she has worked tirelessly to shape the Carefirst employee experience by driving robust and progressive thought leadership, including advocating for diversity, equity, and inclusion throughout the organization. Help me in welcoming Angela Celestin. Thank you. Up next, we have Howard University graduate Dr. Cynthia Major-Lewis. She is the Director of Psychiatric Emergency Services and Assistant Professor of Psychiatry and Behavioral Services at Johns Hopkins. After graduating from HU, Dr. Lewis also attended Meharry Medical College, a historically Black medical school where she graduated in the top 5 of her class before completing her psychiatry residency program at Johns Hopkins Hospital. Dr. Lewis was recently named co-chair of the Baltimore City Suicide Prevention Legislative Workshop, or Work Group, by Baltimore City Council President Nick Mosby, and she is also a member of the Legislative Committee for the Maryland Psychiatric Society and the Johns Hopkins Medicine Behavioral Safety Steering Committee. Dr. Lewis hopes that targeted resources and management of the chronically mentally ill will improve social detriments and quality of life for this population. Dr. Lewis, thank you for being here. Okay, all right, so that's it. Thank you all for participating. Thank you all for being here. I'm gonna see if I can get up on this chair with my... Okay, all right, let's get started. So the COVID-19 pandemic has brought social and racial injustice and inequity to the forefront of public health, highlighting that health equity is still not a reality as COVID-19 has unequally affected many racial and ethnic minority groups. Dr. Shiraza, what are some other reasons that the virus has disproportionately impacted the Black and brown communities, and what can we do collectively to combat this disparity?
Good afternoon, everybody. Thanks again so much for having me on this panel. I'm honored to sit amongst such esteemed experts in their respective fields, so really appreciate this opportunity. So if you were here earlier and you remember, we had Principal P come up, and one of the things that he specifically spoke on was the staggering statistics when you looked at mortality rates in DC. And unfortunately, that's not unique to DC. We see that here in Baltimore City, the birthplace of what's known as redlining. And all of this, we believe, is due to something we in public health call the social determinants of health. So it's the environment in which we live, work, play, worship, and grow. So our built environment. So many of African Americans and those in our Black communities and brown communities, our health outcomes can be predicted by where we are born. So the zip code that we're born into, we know that that child's gonna have higher risk of infant mortality when they're born, just because of the built environment that they're being born into. And again, this environment was built, right? So we are getting the outcomes that we created based on previous policies. So a big part of our responsibility, and we saw this certainly throughout COVID with African Americans being more likely to work essential jobs, having less access to transportation, having less access to healthcare, for example, or when we do seek healthcare, there's the implicit biases that exist within the healthcare system. So how do we address this, right? So first, it's recognizing the issue. And so as horrible as COVID has been, I think it's brought to light what so many of us who work in healthcare or public health already knew about the disadvantages and the disparities when it came to certain health outcomes. So now that we know, it's really a combination of both programs and policies. So looking at many of those old policies, again, the redlining and other like policies that even if it's not called redlining now, redistricting, whatever you want to call it, that exists today, and making sure that we address those, but also putting the programs in place to address those disparities. And so infant mortality, as Principal P mentioned, Baltimore City is also the birthplace of a program called Be More for Healthy Babies. So this was a program that was launched almost 12 years ago now to look at infant mortality disparities and to really focus on neighborhoods and areas of the city that saw this stark difference between Black and white infant mortality rates. And so that's the program that you put in place, but then you also build policies around how you can address this and address the downstream effects of the older redlining and other policies.
And hopefully you all could forgive me if I want to jump in with some other questions. I know I interviewed with you early on in the pandemic, and we talked about this disparity and reaching out to Black and brown communities specifically. And one of the things that you all talked about was I don't remember the exact term, but trusted advisors, pastors, things like that. Looking at it on this side now, almost 2 years later, what did you find to be the most effective, or what have you found to be the most effective so far? Because we still have a ways to go.
Yeah, absolutely. So, I mean, I think it's twofold, right? And I mentioned a little bit of this, and again, we've heard some of the statistics. So first, it's making the data public. So again, one of the things that I think the pandemic allowed us at the health department to do was to have this live dashboard, right? Where we were tracking and the public could visibly see these are the disparities that we're seeing, that we're also looking at on the health department side in terms of race. And so now that we all are speaking from the same page, we all are in agreement about these differences, then it's who are those trusted messengers? And it's not always necessarily going to be the government, right? And we recognized that early on. So we knew that we were going to have to strengthen the existing bond with community organizations and community groups who are trusted messengers, and even hire within the city, make sure that we were very intentional about who we hired to be that trusted voice. And so we established something called value ambassadors. And that's really focused on populations that have been disproportionately impacted by COVID-19. So each of those populations has a specific value ambassador and value team members that are community members, right? That it's not the health department, it's community members, and those are the folks that are doing the vaccine education and outreach to the community, talking about the importance, talking about their own experiences with vaccine deliberation and hesitation, whatever you want to call it. So that's, I think, been critical to our success. It's been having campaigns that are designed alongside the community, not for the community. And so our Be More Vax campaign, again, getting that input and user feedback to make sure that the messaging is on point for the groups that we're trying to reach.
Well, throughout history, dangerous racist health policies and clinical experiments have targeted particularly vulnerable Black and brown communities. Now we are being encouraged by medical experts, of course, government officials, spiritual leaders, and other influencers to get vaccinated for COVID-19. From the Tuskegee experiments to Henrietta Lacks' experience to the economic and cultural inequities in the U.S. healthcare system that disproportionately harm Black and Latinx communities, there are genuine reasons why some are skeptical about the COVID-19 vaccines. So Dr. Lewis, how do we reconcile the ills of the past and the current needs of our communities?
One, thank you for having me. I'm glad to be here and again to sit on this esteemed panel. And that's a great question, and I think it really came to play during the COVID-19 pandemic, especially when it came to encouraging people to get vaccinated. And I would say first, there has to be acknowledgement. There has to be acknowledgement that these things happened, that it was real, that it was detrimental, and that it created a lack of trust in many individuals. Not only with that acknowledgement, there needs to be accountability. And, apologies, but apologies really don't have a lot of, worth if it's just words and not any action. I think there needs to be like repentance along with that, with the apology. Also, there has to be, kind of representation. People, when we're expecting people who have always, who've been concerned about, these past experiments and, trust. I can name so many times when patients come to me at Hopkins and say, why should I trust you? This institution was involved in, the Henrietta Lacks, concerning issue, and why should I trust you now? So for me as an African-American physician, I can, as a representative of, my patients, there are studies that show that people trust physicians who look like them. So I will say, look, I acknowledge this happened, but my concern is you looking at what happened in the past and not allowing yourself to be protected for the future. I will say, coming from Meharry, with my classmates, we were in Baltimore City. The way that the vaccines were rolled out is that healthcare workers were part of the first group that were able to get them. So we made a pact that we were going to get the vaccine. We were going to put it on our social media, showing that we're getting the vaccine. We were going to acknowledge that, yes, we understand there's a lack of trust. There's a lack of there's concern that this vaccine isn't going to do what it's supposed to do, that it's, that there's things that it's going to do that are detrimental. But we were going to say, look, we're going to do it. If we can do it, then you can do it. And we then posted later that, look, we're not having many side effects, or if we did, they weren't that bad. And so then, I had family members who didn't trust, who I got into arguments, knocked down, drag out, and I said, I get it, I understand, but I'm so worried that this is affecting our communities at much higher rates. We have a lot more diabetes, high blood pressure, asthma, so we really cannot let the past, kind of impact our future. So again, representation matters, authenticity matters, and then also research, research on people who look like us. That's going to allow us to make better, the labs and all to make vaccines and medicines that can really impact us in a way that they understand how it's going to impact us. So I would say, reparations. I think we can have a whole other discussion, but I know with Henrietta Lacks and in other situations where wrongs have been done and nothing's been done about it. I do think with George Floyd's murder, it really allowed people to kind of sit still, look at what's happening. The people who were more in power had really no choice but to see what was happening. And I really do think it really, for me, it allowed me to say, look, I'm no longer gonna kind of sit quiet or be feared that I'm gonna be labeled, kind of the angry black woman. I'm really gonna say that this needs to change, something needs to happen, and I think it did open up a broader conversation. So to go back to the question, I'm really, one, acknowledging that these things happen, taking accountability, making sure that people who look like us are kind of at the table and making, some of these decisions that need to be made, and really encouraging and listening to those who are struggling. We're all aware that there's a lot of misinformation about the vaccine, so there's different camps, people who you're not gonna tell me what to do, this is my right. That's one camp, but another camp is, I'm fearful because of these past things, so that's our job, to listen, to not criticize, but to be open about what these concerns are, and to encourage and to help people to understand that if you don't do this, there could be serious consequences. So again, it's multifactorial, but it's our job as clinicians, and I will say this also, looking at ways to get more, Black and brown kids into the medical field, into, becoming researchers and scientists, because studies do show that people are more open to letting down their guard or opening up that trust when they're being treated by people who look like them.
Thank you. We've been talking about mental health and wellness throughout the day, and frankly, the pandemic has been stressful on a lot of people in a lot of different ways. You could from extreme to just not even realizing, oh yeah, over the past couple years, I have been more anxious. I have been more stressed. I haven't seen my family in a year and a half, and certainly Black and brown communities just as much, if not more. How would you say, Dr. Lewis, first off, how are health institutions managing newly diagnosed patients while also managing the health of chronic mentally ill patients?
That's a great question as well. And I will say that the suicide task force that I'm co-chairing, it actually was born out from the pandemic. And there was a situation where a mother drove her car into the harbor with her children in it. And that created a concern. But also there was a study that one of my colleagues did where typically when you look at suicide rates, there is a higher, African Americans and Black and brown people usually committed suicide at lower rates than their Caucasian counterparts. And with the pandemic, you would have thought that with the stressors that there would be higher suicide rates in the typical kind of Caucasian community, that it would kind of follow the trends. But what we found is that there were actually higher suicide rates in our Black and brown people. And it kind of is borne out from when you look at the essential workers, from the the stressors of kind of the isolation and all. There seemed to be a protective measure for people who had the type of jobs where they could be at home, where they could be with their kids, where they could get out of the rat race and not have to go into the office every day, whereas our communities, we didn't get to stay home. A lot of people had to be those grocery workers or those bus drivers or, school teachers were at home as well, but it really showed, and it was alarming. It was alarming that it just flipped, and that was in Baltimore City. So again, the pandemic just really brought out a lot of things. I will say from a mental health perspective, part of my passion is our chronically ill, our chronic mentally ill population, who I think has gotten overlooked. When we look at acute, psychiatric issues like suicide, which is a hot topic, and there's a lot of monies that are available for suicide prevention, for crisis stabilization. That's where a lot of the monies are going. But we have a huge population that from the 60s with deinstitutionalization, which has created our homeless population and our chronic mentally ill, who are just kind of this revolving door of just failing treatment. So we've got to do a better job of making sure that we're not only dealing with the acute issues that arise, but make sure that we're not forgetting all of the chronic issues that are still going on and need just as many resources diverted to that as well.
Oh, Joni, this is directed at you. I'm wondering if we can talk more about younger folks and really how kids are managing. What are you finding in terms of just how are you all able to keep them engaged and social and on the right path as we're going through this time?
Yeah, so let me just put one thing out there first, Kai, and that is from a young person's perspective, this crazy homicide rate that we have is way more of an issue that they are worried about in terms of when you try to balance, like what's more important, like COVID or am I going to get shot walking to the store? We had, 338 murders just last year alone, and right now in 2022, we are on pace to do more than that. Well, we only day 55 into the new year, and we've already had 51 murders. So that right there is taking a really big toll mental health-wise in terms of our young people, in terms of what's important to them. COVID just made everything worse. I said this before, and this is what I say daily, is like, COVID is like the predator in the ocean that's coming to bite you up, but you've already drowned. Young people have been overwhelmed, stressed, depressed, angry, overwhelming anxiety, and feeling like they have nowhere to go. My school is failing me. At home is failing me. All these systems that are supposed to be taking care of me are failing me on a daily basis. For young people who are lucky enough to know that there are resources out there, and Heart Smiles isn't the only one. We just happen to be doing a really good job, which is why I'm so excited to be invited to this conversation. But for young people who know that there are resources, they're able to manage a little better. But for young people who are falling through the cracks, they have no idea how they're going to survive the next day. Shout out to Dr. K at the University of Maryland School of Social Work, because in the middle of the pandemic, she had a crazy idea which has been making headlines around the city in terms of young people. We started something called the Healing Youth Alliance, where young people are being trained by social workers to learn about mental health, to learn about how to relate their experiences and experiences of their peers to like the clinical aspect. And now they are becoming peer mentors and peer responders to mental health crises, and they're able to reach and teach young people and also teach adults in these organizations and institutions that want to have better relationships with young people, how to create positive relationships with them from a mental health perspective.
How do you find them? How do you get to them? What is your outreach?
They find us. We don't have no outreach. I wish I could tell you we got some fancy marketing plan, but young people who are locked into Heart Smiles and are excited about what we're doing, they can tell you their story about how somebody else told them about Heart Smiles. So it's really through this network of word of mouth. I heard from my classmate or my cousin told me about Heart Smiles. Every heartbeat has their own story about how they got to Heart Smiles, and it's pretty much all the same. Like they came one day to the session they didn't want to come to and just never left.
Amazing. Thank you. I feel like each and every one of you, we could probably spend an hour for all of you, but unfortunately we don't have that kind of time, but thank you. Angela, can you tell us about Carefirst's efforts to support its members and the community with regard to mental and behavioral health, as well as how the Carefirst Better Together campaign has contributed to communities reaching target vaccination rates?
Thank you. How did I get to go last? I mean, following the three of you is just, I'm just getting chills sitting up here. You know, I woke up this morning and I do a little prayer in the morning, and the prayer that came to me this morning was 1 Peter 5:10, and it says, suffering is not either eternal nor is it complete. And I was just like, what a fitting verse for the morning, right? We're talking about mental and behavioral health. It's not complete. We're going to go through tough times. I think one of the speakers in the earlier panel talked about this isn't a permanent state that you're in, right? We all go through hard times, and then we all come out of hard times. And so it's fluid, right? And so I just thought that I wanted to, really bring that today because it really touched me. So I want to thank you for, having Carefirst, having me represent Carefirst on this panel. I got into the healthcare industry 6 months before the pandemic hit. I've always been in human resources, but I've been in financial services. So it was October 2019, I came to Carefirst, and then in March of 2020, the pandemic hit. And I have been really lucky to be, I would say, a part of this organization that continues to invest in the community. Our mission is to increase access and increase access to healthcare through more affordable measures, right, and through our outreach programs. And so when the pandemic hit, one of the things, and I think you were talking about this, Dr. Hill, you know, we knew there were communities that were not going to have the same level of access, right, because everything went to telehealth and telemedicine. Well, if you are a behavioral health provider in communities that support Black and brown communities, you may not even have the platform to provide that level of mental and behavioral health service, right? Because your patients are used to coming to see you. So Carefirst really stepped up and donated and contributed and gave grants to a whole bunch of mental health and behavioral health providers so that they can reach their clients where their clients needed to be reached. You talked about training, Joni, and Carefirst really supported those providers in the community with training in mental and behavioral health. So they really put more money and more investment in the community for people who were already giving to the community but maybe needed a little bit more training around behavioral health, like the young lady in the back was talking about the JUCO colleges. And so that support was just amazing. And then partnering with the right organizations who are already out there, right? Casa Maryland. So we put together a Better Together campaign, right? And let me just talk to you a little bit about how this came about. It was around vaccination. We were sitting virtually with our CEO, Brian Pennick, and we had a executive leadership team meeting. Every week we have this meeting. And we knew getting vaccinated was important. It was going to be important. But we also knew, like, well, how are we going to help to get people aware that getting vaccine is important? And so we started talking about, this is at the executive leadership meeting, making it a mandatory requirement for our employees. And this was early 2021. And I was sitting there like, what? Mandatory requirements? That doesn't, vaccines in the Black community, making it mandatory? Oh no, we've seen what mandatory vaccines have done to us. And I want to say this is why I like being at Carefirst. I brought up that conversation. It was a safe enough space for me to speak about this and another one of my African American colleagues. And we talked about how is that going to land, right? How is that going to, let me tell you what people may start to say and think. And so instead, Brian came back with this Better Together campaign. So let's educate people about getting vaccinated. Let's make a commitment, similar to what you said, right? Like, if you do it, I'm gonna do it, right? If I see my friend doing it, if I see my trusted healthcare provider doing it, I'm gonna do it too. And so we got many of the organizations, all of the organizations listed here today, we said, look, we're gonna ask our employees to take a pledge. We're gonna give information about the vaccine. We're going to pledge to get it when it's made available to us, depending on your age group. And we're going to ask our neighbors in the healthcare community, our neighbors in Port Discovery, I'm on the board, the Children's Museum, why don't you ask your employees to take a pledge when it's available to you? And in the meantime, we're going to educate you on what the pros and cons are about vaccine, why vaccines are safe. So it started, having a safe conversation in a safe space. And then it birthed this idea of, if we do this together, if we show that we're going to step into this together for our communities, and we're going to get more people involved. And then, with the money we raised, because for every organization that took the pledge, we made a contribution to local community organizations who were out there on the front lines giving the vaccine out. And so it gave resources in the community for our healthcare workers to actually provide the vaccine free of charge, to those underserved and underrepresented communities. So that's just a little bit, not everything, but a was proud of those.
Thank you. So my last question is for Dr. Shiraza. It's a loaded question, I'll tell you this right now. What's next? Are we out of the woods? Can you even say? What do we have to anticipate? You know, Omicron seems the numbers are going down. We seem to be in a good place right now. What can we anticipate to happen now?
That is a loaded question.
Yeah.
It's a good one, though. You know, I'll first start by saying I am encouraged by the significant decline in cases and hospitalizations. That is encouraging. So everyone should be encouraged by that. You know, at the same time, we know that there is a subvariant now of Omicron, right? And that there continues to be a risk for variants to develop. So I do want to use this opportunity to just state the importance of vaccination, right? As we enter into what's the next phase of this pandemic, vaccinations remain important to really help to reduce severe outcomes, hospitalization, death as a result of COVID, even if you've had COVID. So, you know, now we know that a number of people, because of Omicron, also had COVID. Vaccines are still important, getting the full series, getting boosted. So the good news is that we do have many more tools than we had 2 years ago, a year and a half ago. We have vaccines, which are really the key to helping usher us into this new phase. And we certainly have therapeutics available as well. So I think we're certainly on the path to COVID becoming more endemic, like the seasonal flu. I don't know that we know the exact time frame of when that will be, and I don't know if we know yet if there's going to be true seasonality like the flu kind of has this seasonality. But again, I think we're absolutely moving in the right direction based on decrease in cases, based on decrease in hospitalizations, and honestly, because so many people either were exposed, you know, when Omicron happened, or have been vaccinated and boosted, all of that helps to kind of strengthen our overall immunity. So that's a good thing. But I would not say we're totally out of the woods. I want us to continue to be vigilant, and certainly, if you know friends or family that have not yet been vaccinated, we talked a lot about the hesitation that exists within our community. You might be that trusted voice, right? We all have a role that we can play, even if you're not a healthcare professional. So, you know, talk to those friends and that family member who's still holding out, and encourage them to get vaccinated and boosted as well.
All right, well, that is actually all the official time we have, although I want to give you all an opportunity to share any resources, links, websites, or anything like that. And I'm trying to see I was trying to get a nod from someone. Can we take a couple of questions from, okay, so let's start with sharing any resources that you all may have, want to go down the line, and then we'll see if there's anyone who has any questions.
Yeah, absolutely. So the resource I talked about, the Healing Youth Alliance, you should get them on Instagram at Healing Youth Alliance, and also Heart Smiles if you want to connect directly with us or with me, Heart Smiles MD.
Yeah, so our primary website is coronavirus.baltimorecity.gov, and there are a slew of resources. We are still testing throughout the city on a weekly basis. We are still vaccinating throughout the city, vaccinating children as young as 5. So please go to that website for more information around where we're testing, where we're vaccinating. We have a program with the Enoch Pratt Free Library that is distributing free test kits to residents. So certainly check out Pratt Library's website, prattlibrary.org, for more information on where they're distributing free test kits.
I would say you can go to carefirst.com. We have contributed about $60 million in resources and grants and funding to help increase access and affordability of healthcare, and we'll continue to do that. Our partners like Turk House and House of Roberta, I would say, you know, reach out to your local communities. These organizations support substance abuse, physical abuse in our communities, support, you know, really do a great job just supporting the youth in our communities as well. So we will continue to provide grants to increase access and affordability to healthcare for all individuals. So carefirst.com, please go ahead on the website and take a look at that.
And I would say I'm at a hospital setting, so Johns Hopkins is right down the street. But I would say Baltimore City, Baltimore Crisis Response is a great organization here in the city that not only responds to people in crisis, but also they have the ability to find people appointments for mental health appointments that are hard to find, and it often takes a long time to get them. But they are funded for a lot of mental health resources, and I think people don't utilize them as much. And I would say recently we've had a kind of a cluster of kind of high-profile suicides, and that usually when there are suicides, unfortunately, that's a risk factor for more people to attempt or commit suicide. So I would say that I would just encourage everyone to kind of check in with your loved ones, your family members, check in with yourself. Do not be afraid to ask how someone is feeling. Some people have a thought that if I ask someone about suicide or if I talk to my children, that's going to spark someone to try to act, but actually it gives someone the opportunity to let someone know how they're feeling. And again, depression and mental health issues, these are illnesses, and these are illnesses that can be treated, and we can save lives just by checking in with each other. When you see a loved one who is not themselves, who's isolating more, who's not eating or sleeping or kind of doing the things they normally do, that's a red flag. If anyone starts talking about, kind of making plans with their monies or kind of giving things away or doing things differently, do not be afraid to ask your loved one how are they feeling, and do not be afraid to demand that they get help if they're refusing to. So,
but I would want to add two other resources. 7 Cups, it's like the largest behavioral health virtual platform, 7 Cups. That's covered by Carefirst through our organization if you have insurance, but it's a great organization, behavioral and health care organization. And then Close-Knit, for many people, especially in the Black and Brown community, we don't have a primary care physician that we feel comfortable with. So Close-Knit is a provider company that Carefirst recently launched last year, and we provide virtual behavioral mental health. So please check out closeknit.com as well.
Fantastic. Do we have anyone who has any questions for our panelists? There has to be someone. There you go.
My name is Ralph Smith. I'm a volunteer, and I volunteer because the need of the CIAA is impressive in terms of beyond sports and reaching out to the community. But I have a question regarding this killing of young black men and whether or not any of you can address this issue from a mental illness point of view, because obviously there's something going on when we're just alarming number of African American men younger than 35 seems to suggest that killing is natural. So have we begun to look at this and addressing the mental illness issue? Because obviously the impact of the incarceration of these young men and is alarming, or the murder of young black men, need to be looked at to address it both with mental illness and perhaps even in the jury system as a way to help these young men. And have any of y'all begin to examine this from a mental illness point of view, this killing?
As the psychiatrist here, I would say that is such a good question. And, when we think about mental illness, there are several major mental illness like schizophrenia, bipolar disorder, major depression. Then you have your anxiety disorders and your eating disorders and things of the like. We also have personality disorders where, antisocial personality. When we look at folks who have no regard for life and who have no problem taking a life and not even being fazed by it, those are individuals who you might look at if you were to evaluate them, you might want to find out, did they have any behavior problems growing up, like fire setting, cruelty to animals, conduct disorder, difficulty with authority. That kind of puts someone on a path for developing an antisocial personality disorder. When they're younger, there might be traits, but then it becomes disorder. And unfortunately, these folks lack empathy. They lack sympathy. They're kind of thinking about themselves, thinking about the rewards. So when you look at kind of the personality makeup of people who really have no qualms taking a life, that antisocial personality is usually at the heart as opposed to something like schizophrenia, bipolar disorder. Now, depression, when we look at, poverty and growing up in an environment where you've got to make, you got to make it happen. You might have a single mom, who's kind of getting out there working, and you're kind of left alone to your own devices. That's creating, a situation where someone might be more at risk for joining a gang or finding their comfort in people who might not have their best interest at heart. So we try to dispel the myth that it's not mental illness per se, but it's kind of the general makeup of your whole mental health. And that antisocial personality traits are at the heart of the ones who are kind of taking lives. Now, we do know that there's more increased violence in some patients, if there's paranoia and all, but when you look at people who are going into the schools and shooting them up, and when we're looking at the crime on our streets, there's more of just kind of this lack of empathy. And again, not everyone fits that bill, but we want to make sure that people don't think it's the folks with major mental illness. They are not really the ones who are committing the crimes at the level that's going on. But it's such a systemic problem when you look at lack of, people aren't in school. And I must say, marijuana, we're having a much different conversation about marijuana now with the legalization in most places. I do agree with decriminalizing marijuana, and people shouldn't be locked up for life or anything for marijuana. However, I don't think I'd have a job at the emergency department if marijuana didn't exist. If we were to look at and again, with you being with the public health and with what you do, I want to know how many people have marijuana in their system when they're committing crimes or when they're, when they're kind of finding themselves in these situations. There has been a recent study that's shown that marijuana might have a link to increased suicide, not because of depression per se, but just because of the marijuana. It's kind of a new study, but I think that we really have a problem with marijuana. And when I look at a lot of our younger people who come into the emergency department, I would say 90% of them probably have marijuana in their system, and it's a destabilizer of mood. And when you're under the influence, something that might make you a little bit more impulsive or make you do something that you normally wouldn't do, like alcohol or marijuana, that then becomes a problem. We call things substance-induced mood disorders. Someone can have symptoms of depression or look like they're manic or look like they're schizophrenic, but it's because they've got that marijuana or either other, substances in their system, and then once they go away, they come back to their baseline of normal mood, normal, sleep, appetite, energy, what have you. So again, we want to make sure that the major mental illness, when we talk about chronic mental illness, don't get blamed for this crime spree, but certainly antisocial traits, and even when people are manic or with bipolar disorder, when you're manic, you're a little bit more impulsive, you're more erratic, you're doing things you normally wouldn't do, and you might act out, but you're not usually picking up a gun and going and taking a life and not having any qualm about it. That's what I would add.
Can I say something on that? All right, because sir, you're making me have to stand up on this one. I got so much to say, and I promise I ain't gonna keep us here all day. From a young person's perspective, you look at the world so much differently once you tap into your value and once you tap into your purpose. There are so many young men that we deal with on a daily basis, and I'll give you an example of just one. A few months ago, he threw his gun in the gutter. He was one of the perpetrators out here participating in some of this stuff. He threw his gun in the gutter once he realized that now he has something to live for, and now he has a support system that's going to help him do what he never thought was possible, which was be something in life. A lot of these issues and stuff that these young people are dealing with, especially mentally, those things are exaggerated when you don't have proper support and when you are in these broken homes and in these communities by design, that's designed to keep you drunk and high all day, and that's designed to make you think that you can't be anything other than that 3-block radius that you see every single day. Yeah. So more people in the community, boots on the ground, helping young people tap into their value, tap into their purpose is really one key thing that's going to help us regardless of the mental illness or some of the other things that they're facing. Because when you have support and when you have love and when you have care, it'll change the way you view the whole entire world.
And if I could add one thing, I mean, I think my colleagues up here stated it very eloquently, but even just looking at the data. So as a part of being the local public health department, we run something called a child fatality review, and we have for years. We examine every death of a child between the ages of 0 to 17 that happens every single year. And so that's inclusive of deaths in the newborn phase up through the homicides that we're seeing in 16 and 17-year-olds. And again, my colleagues have touched on most of that it's not necessarily that child having a mental health issue or disturbance. Perhaps there are family members with that, parents or caregivers, but it is the lack often of support system. It is that child falling through the cracks of the system. For example, DSS being notified early in that child's life or notified multiple times, chronic absenteeism, the linkage between that, we see chronic absenteeism in almost every case of the 16 to 17-year-olds that are murdered. Previous non-fatal injuries, so non-fatal shootings, are also quite common in this group, and that's a warning sign, right? So that's prior to. And so what's obviously very concerning is that these deaths are preventable. Right? When we think about deaths, especially again in our young people, they're preventable. There were many kind of red flags along the way in their lives that got us to this point. And so I think it is much larger than mental health. Absolutely needs to be appropriate mental health and supports in place, but how are we also supporting them in the community, like the work that Joni's team is doing? How are we making sure that parents have appropriate support? If there are parents who are suffering from substance use disorder or alcohol abuse, do they have the appropriate supports in place? Do they have the tools? If there are parents who are re-entering after being incarcerated, are they appropriately supported to parent and not re-traumatize? Or those parents that have experienced their own trauma and don't understand how best to relate to their child. So it's much larger than mental health, though that is obviously, the support is needed in that area.
And I would just add, as a corporate citizen on this panel representing, a big corporation like Carefirst, we have 7,000 employees, right? If you count our full-time employees and our contingent workers. We just implemented a volunteerism goal as part of our annual incentive plan. And we got questions, right? Were you gonna pay people to volunteer? Yeah. Right? When you got 7,000 people in the DC, Maryland, and Virginia area that can impact positively the communities in which we serve and the members that we serve, right? Over 3 million members. Yeah, we're gonna pay people, to volunteer. And so that's a goal of ours this year. So for those of you who have employers, really start to question, what are your employers doing for the communities in which you live and work? As the head of human resources, I'm also responsible for ensuring there's good workforce development programs in our communities. Because if, like you said, if people don't have jobs, if they don't have skills, if they don't have the training to, get decent paying jobs, then they can't feed their families, they can't feed themselves. So really start to push these organizations around, what are you doing for the community? How are you showing up in the community? And I think the more people, I get these questions all the time, as an HR person, what are we doing about this? What are we doing about the crime in areas around us, right? And so I think we have a responsibility, all of us who are working in these large corporations who are actually, someone mentioned, working remote. 95% of us have been able to work remote. So then it is our responsibility to kind of give back and to do better, so.
All right, well, thank you all so much. On behalf of the CIAA and Visit Baltimore, we want to thank everyone who took part in this really fantastic discussion today, and especially our panelists who do so much for the city, for the people of the city, and for everything that we need to do to make society better in every way. So thank you. We can give them a round of applause. Thank you, thank you, thank you. All right, well, that is the end of our panel. Thank you all for being here. We do want to thank our local contributors once again: Carefirst, Johns Hopkins, University of Maryland Medical System, and Art of Balance Wellness Spa. And thank you all so much. Thank you for having me. I really appreciate it.